Good morning, everyone. I'm Dr. Lee, orthopedic surgeon from Hospital Miri. Today, I would like to conduct the topic of De Quervain syndrome, which is commonly happens in our middle age group of people. So De Quervain syndrome is the meanings of this is the Thinosynovitis. So the Thino means tendons, and then the Syno means synovium membrane around that surrounding the tendons, and the itis means inflammation. So it means the inflammation of the tendons, synovial sheath of the tendons. So we call Thinosynovitis. Right? Then the De Quervain syndrome's Thinosynovitis is the tendon sheath inflammation surrounding the adductor pollicis longus and also the extensor pollicis brevis, which is our first extensor compartment over the lateral aspect of the radial, just slightly proximal to the radial styloid. And this compartment have two tendons passing through. So when this tendon sheath becomes inflamed, then whenever we do the flexions of the thumb and the opposition of the thumb or the ulnar deviations, then we will feel pain over these regions. Okay, and the risk factor for the population that getting this De Quervain syndrome is those are repetitively using the wrist, like during the radial deviations, like how you carry your baby. This group of people is usually tends to get this De Quervain Tenosynovitis, and also the gamer, just like in this picture, you see that these regions, because you have to consistently holding the remote, then you will need to maintain. So this overuse of this tendon, you will cause inflammations, then you will cause pain. Or trauma means injury to this tendon will tends to get De Quervain Tenosynovitis. Postpartum is those are carrying the baby. When you persistently every day you have to carry the baby, then you will have this risk to get the De Quervain syndrome. Okay, we go to next. So the signs, the classic one, we are using the Finkelstein's test by flex your thumb and then grip your finger. Then this is ulnar deviate. Then you will feel severe pain over these regions. When you doing this test and you feel pain, means that you are having the De Quervain syndrome. Yeah, means or you don't have. Okay, so it's clinically, when we do the examinations, you can feel that the thickening of this tendon sheath usually is you can feel a bit, but it's not so obvious because it's a sheath that covers the tendons to the bone. So it's holding the tendon on the bone, so that when you glide, it's glide along the bone. Okay, so when this inflamed, then the tendon sheath, the tunnel for the tendon to glide become narrow, and the tendon sheath become inflamed and injured. So it enhances the symptoms. It means the symptom becomes more obvious. Okay, and when you palpate, because it's of inflammation and thickening, so you can feel quite obvious, like a bump. So the second is the Finkelstein that I mentioned. You grip your thumb and ulnar deviate, then you will feel pain. So we'll move to the treatments. Treatments are most of the time when this symptom it just happen, it can resolve by doing the physiotherapies or change your movement habit, and those work that causing this symptom, you can modify or you can stop. Then the symptom will be improved or resolved. But when the symptom persists, because some of the things, like you have to jaga your baby, right? You cannot just let your baby like that. So you need to still have to carry the baby every day. So the pain will keep going until the baby start walking. Then you will less carry the baby. Then in this case, when you cannot avoid this kind of movement, you can start doing the physiotherapy, or you can start taking the painkiller. And if not improving still, then you can try injection first. Okay, the second point is the injection. First, by doing the physiotherapy and the pain control, 80%, or okay, I would say 85% of the population will improve and the symptom get resolved. And less than 10% of the population, it will persist. That's when we need the injection or the steroid. But this steroid also can improve up to 95% of the symptom to be resolved or improved. But when the person is still persistently doing the same movement, repetitively doing the same things, then the symptom after of long term of injury, the tendon sheath become hardened, and the tunnel become narrower, and that's when we need to move to the surgery. Surgery is a very simple surgery. You can give very simple, like giving the local anesthesia over these regions. After it's numb, then we can start cutting. The wounds around 2 centimeters in size, in length. So after we move in, we release the tendon sheath, so the tendon will glide without the resistance. So the symptom will be resolved. The surgery, this is a simple surgery. So the surgery usually is indicated after 6 months of conservative management, including the medication, physiotherapy, and injection. If all this fail, after 6 months the symptom not improving, then we will recommend it for the surgery. But surgery, it can provide the best, it's the best method to treat this symptom, but it's not 100%. I would say 99% to get this symptom to resolve. So if it recurrent, then I mean after the operation is done and then the symptoms is persist, then if possible the tendon sheath is not completely released, that the risk is less than 1%. Okay. Yeah, because you're persistently holding your hand in this position, right? Okay, but after sometimes it will become tense because the tendons already keep in the position. So after a while, like few hours, you try to stretch and if you feel hurts, right? If possible, that it progress slowly becomes a chronic disease. So what I recommend is try not to play the game for long duration. Yeah. After you stretch for a while, you relax the tendons, then it's okay already. Very unlikely the other compartment. You know, we have 6 extensor compartment over here. This is the first one, which is called Decurrent syndrome. Then after that, we have 2nd, 3rd, 4th, 5th, and 6th is here. So unlikely for all other 5 to get problem of narrowing of the tunnel for the tendon to glide, because this region is the most frequent we use. Yeah. So this tends to have the problem. Having here, that is not the problem of the Decurrent Tenosynovitis. This is other problem, because over here, our tubercle of the scaphoid is quite obvious here, and it's the first bony prominences that you press over the hard object, so you tend to have pain over here. It's not the same as the Decurrent syndrome. I think that is the A1 pulley over the flexor side, the one getting stenos. Yeah, so we call that trigger finger. Yeah, it's another symptom. It's quite similar, but it's different side, so we have different name, but it's actually the same thing. every tendon is holding by the tendon shift on the bone. So all the tendon gliding along the bone. So you don't see the tendons coming out. Okay, but this region is special name because De Quervain is the one who recovered this. So he named after him. Yeah. Actually, for all the finger, you have risk to have the trigger finger, especially over the A1 pulley at the knuckle here. I mean the palmar side. Yeah. Because this region, the tendon glide the most. So the more frictions, the more risk of inflammations, injury. Yeah. Where is the pain? It usually comes with the pain, but when it becomes chronic, means long term, then you might not be able to feel the pain because it's already stuck. Especially, I think most likely is over the flexor region of the thumb, the flexor pollicis longus. When the tendon get inflamed and then the tendon shift becomes sternose, then the tendon cannot glide through anymore. So that's why when you want to flex, but you cannot, you stop halfway.
Is it risky?
Risky? No. Yeah, just that you cannot use your thumb fully. You lost the function of the thumb. Trigger finger is actually the progressive kind of problem. When you start develop it, then you change your movement or habit, then it will resolve. Mostly by painkiller and also physiotherapy. More than 86% it will be resolved. But if you still continue doing the same movement and same duty, then it will recurrent, means it will come back. Yeah, but after certain periods, then it become worsen. It divides by the stages. Stage 1 is just pain, but it doesn't restrict your movement. Second is when you have a locking problem. Like when you try to close it, you suddenly feel relief coming down. When you want to open, you feel stuck, then suddenly open. That is like a locking problem. But you still can actively, means by your own finger, open it and close it. When you come to stage 3, you will need another hand to help to open and close it with pain. The 4th stage is the terminal, which the finger was stuck either in full flexion or full extension because the tendon cannot glide through already. So means when you the finger in extension, you try to pull it to flex, but you cannot because tendon is stuck already. So that's why you will keep in full extension. Or when you in flexion, you cannot open up anymore. So you will keep in this position. Depend the stage. Usually the 3rd stage onward, we will recommend for surgery. 1 and 2, we are still can give chance for physiotherapy and painkiller, and then the spleen, it will help. Whenever you have repetitive movement that using this tendon, overuse it, then you will have it. Just like you're doing maybe you go for gym and then you keep doing this position. Then the tendon keep gliding over here and cause injury. Then when's the inflammation coming in? Initially, when you overuse, you will have some pain. Okay, it will tell you that you are already overused. That's why it gives you some symptoms and signs, so that you can avoid doing the same thing. And if you're doing the same thing, you will feel pain. Usually, people will avoid it. But it comes and goes, then it will become long-term chronic disease, chronic problem. Those are postpartum. The mother just give birth to the baby. They need to get taking care of the baby every day, multiple times a day. Then that tends to have this problem. Yeah. So, thank you.